So right now I'm going to teach pursed lip breathing. Remember we talked about for certain clients a lot of air is trapped within the lungs. I think Shannon, we talked about it before you walked in. Too much of air trapped in the chest is going to look like what?
Bloated.
Yeah, which we call what?
A barrel.
A barrel chest, right? So for some of these clients, the goal is to get the air out of the lungs more than getting the air into the lungs. So this is why pursed lip breathing really helps for these clients. Okay, pursed lip breathing also helps for certain clients where they are finding it very difficult to pace themselves when they walk. Let's say if they have to climb steps, you got like 12 flights of steps, right? So like around the 6th step, they go out of breath again. So how do these clients are going to do this? By practicing pursed lip breathing. Okay, you guys can try it too. The way we teach is going to be a little different. Okay, so Chris, do you remember we just learned the diaphragmatic breathing? So you know how to do this: in through your nose, out through your mouth. When you're going in through your nose, your tummy comes out, right? Can I see you do that for 1 second, just to make sure you got the technique? Hand on your tummy, the other hand on your chest, and you guys can watch him. All right. So get all the air out of your lungs slowly. Everything comes out. Get your tummy in as you do it. All right, let's watch him now, okay? Nice deep breath. I want to see your hand rise over here. All right, breathe out of your mouth. All right, so when he's breathing out, he's making a nice big O in his mouth. So that's diaphragmatic breathing. When I say pursed lip breathing, I want you to seal the lips and only let the air out come in increments, very, very slow. Now, how are we going to do this? Maybe about 2 or 3 seconds to take in. Maybe about more than 10 seconds to get the air out very slowly. Okay? Now, the way we tell him is, if there was a candle in front of you, if you did the diaphragmatic breathing, you're going to cut the flame out. That much of air is coming out by using this paper. So I'm going to breathe in. You see the amount of air coming out? So that's diaphragmatic flow. But if I'm doing a pursed lip breathing, take a look at the flow here. You see that? So I'm just keeping my lips going like this. I'm letting the air out very, very slowly and gently for a longer period of time. You guys get that? So this one just bends the flame. You notice the one I'm doing right now. So when you, it's like you're flickering the flame, but you're not really bringing a candle, okay? They're just for reference. But most clients will get it. Oh, that means I have to get the air out a lot slower, not blowing out with force. Okay? So you guys do the count. Let's see for how many seconds he's going to breathe out. Okay? And I'm going to put this paper. So breathing in is just 2 seconds or 3 seconds. But the breathing out, I want it more than 10 seconds. So you do it very slowly. Okay? I'm going to put that paper for you. Are you ready? Breathe in through your nose. Alright, now blow out. Now you guys do the count. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 7, 1,000, 8, 1,000, 9, 1,000, 10, 1,000, 11, 1,000, 12, 1,000, 13, 1,000, 14, 1,000, 15, 1,000. So that means he's got more air outside, obviously, right? So this is going to bring all the trapped air outside. Now, how is he going to use this to pace himself? Let's say he wants to climb upstairs, right? You're capturing most of the stuff, right? So let's say I got 12 steps. So what the client's going to do before they start climbing up? Hold on to the hand rise. They're going to take a nice deep breath. They're going to go in, and then they purse the lips. They're going to go. They climb while they're blowing out. When he's out of breath, when all the 15 seconds is gone, they stop. Again they go. They go in, again they continue climbing. So they'll be able to reach that 12 steps without even going out of breath. This is called pacing and breathing. That's what we were talking about, right? So that's how pursed lip breathing helps. Okay, you saw that little flutter of that paper? It was like gently fluttering. What does it mean? That means that the air is not coming with full force. And I want you guys to use the same thing. Just take a piece of paper, hold it at the edge over here on the top. So that creates a big flutter. If you see, if it's glowing like that, it's a lot of force. If it's just like fluttering, that means you're doing the right force. Do you guys get it? Practice pursed lip. 15 seconds heated. See if you guys can beat it. Guess what? I can do a 30-second breathing out control.
Wow.
So with practice, you can do a lot more breathing out too. So 15 seconds because maybe it's the first time he's going to try. Okay? Try and see how long. Whoever is going to be the assistant, do a count. Seconds count to see what is the length of expiration. See, the longer you do it, the better air you're going to get it out of your lungs, which is trapped. All right? You can cut that.